Hello, everyone. I'm so pleased to be part of today's event. Thank you to the ISST committee for organizing the World Schema Therapy Day, and special thanks to Eckhart for organizing the Schema Therapy for Couples program and inviting me to participate. Really, thank you. I appreciate it. My name is Aleksandra Defranc. I'm a certified cognitive behavioral therapist, sexologist, advanced schema therapist, supervisor, and trainer in both individual and couples schema therapy. I have my private practice here in Warsaw, Poland, and today I'm going to present you the body shapes and mapping as a tool for exploring intimate reconnection in the couple. All right, so we are in the presentation now. Okay. So the first thing I'm going to talk about is the setting of the session. During the previous session, when we see that the couple is ready to start talking about sex and intimacy and reconnection, we bring up that the next session we establish with the couple that the next session we are going to use the entire session to talk about it, to explore sexuality, to explore their intimacy, to see it probably in a different way that they will usually do. So they already have this mindset, they have this agreement, probably they bring the topic. If they don't, but we feel as a therapist that they are ready, we bring the topic and we offer them that the next session we are going to focus on that. So this tool is a tool I learned during my studies in sexology, and I incorporate it in schema therapy for couples module. And also I integrate other exercises like visualization. So let's say I make a full package of it, okay? So after establishing and having the, let's say both sides consent to talk about it, we see that they're ready. Then I ask them to close their eyes and we do one very little imaginary exercise. And the exercise is just simply to reconnect for each partner to reconnect with their own body. So I ask them to close their eyes, to really be aware of their body, to be aware of what the body is saying, how they feel. Basically, is to help people that they are really too much in their head or too much in the future, in the planning, to be mindful in the here and now and to be here with your body. All right, so then the next step is I give them colors, I give them pencils, color pencils, and I give them already body mapping shapes in a piece of paper. So I ask them to color with two different colors. We use green, yellow, and red. Their map of their body, how they feel about being seen, being touched in those areas of their body. During the imaginary exercise, when we do the reconnection, depending on how it's how you feel with the couple, what is the stage of the couple, how they feel talking about sex generally or talking about nudity and their body, we can do some imaginary exercise. Even we can ask them to go back in time when it was really very pleasant to be connected sexually with their partner. Okay, so then I give them first the body mapping. Let's say we are going to use our favorite two names, meaning Tom and Betty. Let's say I give Tom the body mapping first of a male figure. So let's say this is him. And then I give Betty her body mapping of a female figure. And I give them the colors and they have to paint it. And then after they finish, I give them another piece of paper with the, let's say, reversed body mapping. So this means Betty will receive a male body figure and Tom will receive a female body figure. Of course, if we have couples within the same sex, or if we have couples that they are maybe one of the partners of both, they are non-binary, okay, we of course give the shapes that are a little bit less maybe, showing the figure more like, let's say, neutral. And if we have two partners from the same sex, then we give, obviously, let's say we have two males, we give them first the first male and we ask them to write their name. Like, let's say Tom would write Tom and he will say me, right? And the other partner, let's say Peter, will write Peter and he write me. And then we'll give them the second one and they will write Tom and he will put Peter, like Tom drawing Peter and Peter drawing Tom. I hope that's clear. Okay, so they do this body mapping. So for the sake of making it easier, I chose Betty and Tom. So we have male and female, so it will be quite easier for me to explain. So we give the female body mapping and we give this instruction. Green, like green light, means yes. And yellow, as you know, in the lights of the traffic, means maybe be aware, be careful. And red is a definitely no, stop, don't go there. Yeah. And the same, obviously, for the male body mapping. This is just an example. It doesn't have to be so detailed. It could be far more simplified. Actually, in my office, the printed version I have, it's a little bit less female than this one. So it doesn't trigger, for example, for ladies that are a little bit bigger or a little bit skinnier, it doesn't trigger this inner critic saying like, oh, this one is pretty, this is not me. Yeah? So we give figures maybe a little bit more neutral. And the same with males. And then the next step is for the partners, for the first partner, you can take the one that is like, I want to be the first one. Let's say in this case is Tom. For him to show his picture, the one that he colored of his own body, so his own body mapping. So if it's Tom, it will be Tom's picture. So here it's this more neutral body shape. And he has to explain the color mapping. He has to talk about the green areas, yellow areas, and red areas, and why is that certain parts are green, yellow, or red. So giving the opportunity for him to explain himself, to explain his body mapping, and for Betty to understand, to hear, to listen to him. And later, we give the microphone, let's say, to Betty, the partner B, in this case, Betty. And first, using the connecting dialogue, she summarizes what she heard, what she understood based on the drawing. The drawing is still present in the session. And she can also ask questions if something is not clear for her. And she says what she learned about the partner, what was surprising for her, yeah? And then she shows her own body mapping of Tom. So she shows the shades and the colors and how she sees and how she thinks about his body. And also, they can talk in this case also using connecting dialogue. Tom can summarize what he learned about Betty's perspective on his body. And they can talk about the similarities and differences and what surprised them the most. So for this exercise, this is the body mapping of our Tom and our Tom's from Betty's perspective we have. So basically Tom said, I'm all green, honey, except one little spot, the red one, that one. You can see there, like, don't go near that place, honey. The rest, I'm all yours, all green, yeah? And Betty says like, well, Tom, for me, it's a little bit different. Almost all of you is green for me, but there are certain places feel sometimes it depends. There's a maybe, when you hug me and sometimes, this area here, I don't feel like having intercourse with you, but I really want to smell you, to touch you. Well, this place here is weird. I don't know what to do about it. It's like, I don't know. It's like, it's there, but it's not sexual. It's not. That depends, your legs are hairy, let's say, right? But, Betty says, Tom, well, there are certain spots that for me, it's like absolute no. And, your beard, sometimes it's, well, I don't know, it tickles my face, whatever she says, yeah? And for example, she will say like, this area's here also. The sweat is there, a certain smell. And yeah, I noticed you don't like, but I thought you don't like the whole area. So I always avoid the whole area, not just this little spot. Yeah. And she says, like, well, there's also one thing. I have these issues with feet. Okay, so this is how they can talk about it in a playful way, but also full of, respect, obviously. And it's important, we as therapists, we set this very safe space. Yeah. So no judgment, just sharing, like, for me is like this, right? And for them, it might be really discovering like things they will never spoke about before. They can learn about why certain areas are not touched by their partner or not enjoyed, but when they don't enjoy when they are touched. Yep. And then we go to the next step. We reverse roles, and partner B, which in this case is Betty, shows her picture. So here I have a more neutral body shape. Those are the ones I actually use in my office. When I'm online, I use the other ones because I didn't have the PDF version of this one. So Betty shows her body first, and also she explains the mapping. So we do exactly the same step, but now with partner B. And then partner A, using the connecting dialogue, summarizes in this case Tom. He summarizes what he learned from Betty about her, how she perceives herself, and he can also ask questions if something is like, "Oh, honey, but why is this red?" First time I hear of it, he was like, "We've been together for 15 years, and I've always been touching you there, and now you tell me I didn't know. Sorry, I thought you liked it, you know." And sometimes this is like really shocking discoveries. Like, well, yeah, no, I don't. So again, they talk about the similitudes and differences and what surprised them the most, like what was shocking, like, oh, I didn't know. So obviously Tom loves Betty fully, everything green, honey, I love everything about you. And then Betty says, like, well, as you can see, most of me is green, but I have these red spots. I hate when you touch my hair because I have this issue that my hair, if you touch it too much, becomes too glossy. I don't know, it starts, I have dreadlocks, it's a mess. I will love you to leave my hair. Don't touch it. Like, forget it exists. Yeah. And don't touch these parts. You don't, this part of my feet and here, the pit arms, it tickles me and I hate it. I don't like it. Yeah. And she would say, like, well, then similarly to yours, yeah, I have this green, this red zone in my back parts in my butts. I don't like it. And this one's here, like my face, it depends how you touch it. Sometimes it's like, yes, sometimes, warning, depends how you do it. If you do it like too intense or with your beard, then, yeah. And this depends if it's too intense, too quickly. I don't like it. Sometimes it's green, sometimes it turns red immediately and puts me off. Yeah, and the same, sometimes I pickle, so it depends how you touch my feet. Yeah. So this is how they can talk about it in a very honest, playful way. That's why we start with first the partner talking about the first one that wants to go to talk about, in this case, Tom, to talk about himself first, to open up. Yeah. And then we give the chance to Betty to talk about Tom's body, and then we reverse. Yeah. So like this, the partner that maybe is a little bit more shy, it's encouraged to share. Obviously, we as a therapist, we are there to help them to stop if something is going out of line, to keep the place, the environment, the therapy room very safe and with space to be honest. Yeah. And then we give them a homework. And the homework is for them to explore with the partner more detailed body mapping, because this is like the initial I don't like. Yeah. When I think about being touched, or when I think about touching you, well, this is what I think about. Yeah. This is like my first impression, let's say. Yeah. But we have different type of touch. It could be just, breathing close to the skin. It could be kissing. It could be touching gently, just with the tips of your finger or with the entire palm, or it could be massaging. It could be using a feather. It could be so many different ways of touching, or it could be simply just looking like, this is the part of my body. That's why I switch off the light, because I hate you to see this particular part of my body. It makes me uncomfortable. So if that part of the body is out of the picture, the lights can be on, for example, says one of them. Yeah. So as a homework, I asked them to explore, to set the mood and play, to use this to discover this body mapping in a very playful way, fun way, to see if changing the light, changing the scent. Sometimes, it might be so obvious for some people, but for others, not that obvious, that just changing the soap, changing the scent, changing the perfume, it can change a lot of things. Yeah. Sometimes just changing the sheets of the bed, it can make the partner feel far more comfortable, less icky, less itchy. Yeah. So what I ask them as a homework using this body mapping is to, for example, the first day just to go and one partner lays down naked and the other partner, what is supposed to do is to just very gently touch with fingertips different parts of the body and having the body map, or just with the laying partner. Let's say Betty's laying and she will be the one saying green, yellow, red. They can use that wording, or they can use different wording. They can say yes, no. They can give like how pleasurable it is from 1 to 5. Like, oh, this is a 1, this is a 5. 1, 5 is like hilarious, and 1 is like 0. It's like no. So this way they can explore different type of touch to see if touching in a different way, different zones will be more green or red. I hope I explained myself. So sometimes like breathing just very closely to certain parts of the body, to the skin, it can be very, very pleasurable. It be very nice. And sometimes it could tickle. So it will become like, oh no, it's tickling me, so it's going off our focus. Or sometimes massaging certain parts, it will be really nice, but massaging the same way or touching the same way other parts of the body will not be. Yeah. So it's about that. Obviously, it's not like every day body will give always the same answers. It's not like we draw the mapping and then it's like, okay, we put it in our bedroom and it's like she likes to be kissed here and she doesn't like to be massaged there, but she likes to be kissed here and, I don't know, touch gently here and a little bit stronger here. And it's always like this forever. Not necessarily, because, it depends on the mood. But the exercise here, it's strongly for Betty to learn to hear her body and express it with words, to say it, to say the yes, to say the maybe, to say the be aware, or quicker, slower, harder, more gently, or no, don't go there, or go down, go up. So actually, this is the body mapping. The idea is for them to explore and express. And in this case, for Tom, let's say we have a very impatient Tom, for him to be more patient, to try to connect in a different way and to listen to Betty, to understand Betty, to look at her skin and to see if she gets goosebumps or not, if she's feeling better or not, to ask, to learn her body by listening to the body, looking at the skin, looking at her reaction, and to listen to her, what she's saying. So it's about this type of connection. That's the main goal here. And also, it's for them to have this instruction, more or less, let's say, valuable for them for the foreplay, let's say, yeah? What is also very important is that when we do this homework, we tell them that sex is off the table. It's about learning. It's about the body mapping. So here I have like the example of the instructions that I can give them, more or less. So we say like, okay, what's the purpose is for them to learn, to explore these physical sensations, to discover sources of pleasure and discomfort, to understand, not to take it personally, just to learn, to be open. It's like this is funny. I always, when I use metaphors, when I talk about sex, I always talk about food at the same time. For some reason, this is for me the easiest metaphor. So it's like learning to cook. Don't take it personally if person that is teaching you is telling you, oh, chop it a little bit smaller, or do it a little bit different. It will be, the taste will be better, or the whole view of the whole dish, it will be better. So Betty, in this case, she is the teacher of her own body. She's teaching Tom, and the other way around, because obviously we do it both sides. Yeah. Okay. So the exercise is for them to have an open mind about communicating things in a funny, fun, playful, respectful way. So we always say that before you begin, make sure, the kids are not running everywhere, they're put in bed, that you are in a private, calm, comfortable setting, that you don't have to run to work in 5 minutes, that you don't have things, that the phones are off, the TV is not disturbing you. Agree that sex, the intercourse, it's off limits. That's not the goal here. The performance is absolutely not the goal. Exploring the body is. You can even say like, okay, for now we are out of this certain parts of the body, let's say. If for the partner it's difficult, to think about having sex, they are very far from it. Let's say they have a couple that haven't had sex for 2-3 years. So the barrier is so big that we start with very gentle, just touch, just to talk about, just to be together in a room and trying to reconnect and feel comfortable with the lights on, or at least partially. The focus is definitely on the sensation, every sensation, scent, hearing, taste, touch, everything should be all they say 5 senses, they all should be put in motion there. And each partner obviously has the right to pause, to stop the activity anytime. They have to feel, this is important, they have to feel that it's a safe space and they can do, they can decide how far to go. Yeah. And okay, so the instructions is basically set the mood, dim lights, play soft music, remove all distractions, take a few deep breaths, relax, try to talk in a very smooth, gentle way, establish boundaries. You can have a safe code like that code, like pineapple means that's it. We are done. Exercise. Good. Yeah. Discuss the comfort zones. That's why the body mapping before you can remember. Remember what is red here. Betty can say like, remember my red. We are not exploring this. Not now. And of course, constantly check the consent. If one of the partners, the lane partner, just let's stay with Betty, let's say she's the first one. If she's suddenly silent, not saying anything, it's really important for Tom to ask. And if he sees that for some reason she's frozen, that something's wrong, he needs to stop. Yeah, he needs to notice this and to say like, I'm noticing that something is going. Yeah. Body mapping technique homework. One partner lays down comfortably, the other uses gentle, very touch, hand, fingerprints, etc. to explore different areas of the body. Start with definitely non-genital areas such as arms, shoulders, back, leg, You start with the green side, with the green, as far of genitals as possible, and we start, to go into close to, let's say, increase the temperature. Yeah. The receiving partner gives feedback verbally. They can use the scale as well, whatever makes them more comfortable and makes them easier. They can say pleasant, neutral, uncomfortable, or we can say, our green, red, and yellow. And after more or less 10-15 minutes, they switch roles. It's important that in one setting, both sides have the chance to explore. And every time they do this exercise, they can differentiate touch. Let's say one day they can just do with the gentle fingertips, and another day they can try, kissing softly different parts of the body with their lips, and later they can use their thumb. It can vary. Yeah. And definitely this is very important, not only giving the feedback when it's happening, but also after the whole exercise, to have a discussion, to talk about it. What felt good, what was surprising, what was uncomfortable. So basically, doing this exercise at homework, it's more or less checking that body mapping that they did here, to see if what was in their imagination, what was in their mind in the setting when the therapist is there, which can be invasive for them, if what they thought it's actually what they felt at that moment. Maybe something changed. Yeah. And we also want them to talk about emotions, discoveries, but definitely not in judgmental way. And after they do the exercise, they come back to the session and they explain what they learned. They don't have to go into details, of course, but it's about talking about their discoveries and how it felt, if it was nice to do it or not. And you might not be surprised. There are some couples that, if they obviously didn't have this huge difficulty in having sex, just difficulty to reconnect, but they still have this good feeling about each other, and they simply, I don't know, the kids were born and a lot of things going on, and the job was on their way, and that's why they stop having regular sex, or as regular as they would want. And then with the exercise, you might not be surprised. They would come and say like, "Oh, we broke the rule." And I was like, "What happened?" "Well, we had sex." And I would just laugh. And I was like, "Okay, how it feels?" And he's like, "Awesome, best sex ever." Like, fantastic, high five, yeah? Even though it was off limits. Obviously, it depends the couple you have. If you have a couple when one of the partners has serious difficulties of having sex, or serious trust issues, something happened in the relationship, and it is a huge block, huge difficulty, obviously it would no good as smooth as that, and obviously the body mapping will not be as green as the ones I showed you here. So what's the goal? Basically, to increase comfort in giving and receiving touch, improve communication about physical pleasure, about boundaries, reduce performance anxiety. When we put sex and orgasm off the table, it's about getting to know each other again. And definitely to strengthen emotional and physical intimacy. Okay, so I hope this clarifies a little bit the tool. You can vary, you can do different variations of it. You can even during the session, you can ask them to imagine in the imagination exercise, imaginary exercise, to imagine they're doing this exercise and they're laying down. You just give instructions, you just tell them, and they're imagining it. And afterwards, they can make a drawing and show each other the drawing. And you can say, like, if you don't feel comfortable now saying this here in front of me, you can just do the drawing, go back home and talk about it. And then do the exercise and see if it's different or not. The idea is to prepare them in a positive way, to open their curiosity about doing it. So basically, curiosity, this is, it might sound a little bit weird, but it's to increment this, what we call the inner child. Obviously, I'm saying weird because we're talking about sex, but talking about this vulnerable curious, vital, full of energy and passion side of us to be present, not the critic, not the judgmental part, because those parts will immediately bring our protectors, our protector modes. And here, what we want is the spontaneous side of us, but also at the same time, this healthy adult aware side that is really able to set limits, set boundaries, to talk about what is going on. And just as one last thing, what I want to say is, I didn't bring here because that will extend a lot of, I will need far more time to talk about it. But sometimes when we have this body mapping, we discover that there are certain areas, red areas, that one of the partners would draw, that just the drawing itself might trigger some memories that were, I don't know, maybe repressed, maybe not really spoken in couples therapy because the partner wasn't ready, or maybe because they didn't really realize. When you see the drawing that some red parts are very, well, they kind of gives a picture of what's going on. And when you start asking, you see that something happened, that there's trauma involved. So if that happens, if this exercise unleashes something, triggers something, then it's very important to stop the exercise, to focus on the partner that was explaining and the trauma is coming out, and to have an individual session or sessions to talk about it, to help the patient to be ready to let's say overcome the trauma. And then we bring these couples again, both of the partners, and we talk about the traumatic event when the partner is ready. Let's say it was Betty. When she's ready, after doing some sessions with us, with us therapists, we bring Tom again, we integrate Tom, and we introduce him to as a healthy adult, to the imaginary, for him to be more empathic and understanding and caring of Betty. Okay, so if you have any questions, if you want to find me, well, this is my website. This is where you can find me. Thank you very much. Thank you for attention. I hope this tool helps you somehow to open up the topic in a playful, fun, safe way, to open the curiosity, to help you sometimes, because sometimes therapists will also might feel a little bit awkward asking about sex, or we might feel a little bit invasive asking about sex. So this is a way for you to have a safe way to open the topic and see what happens. Thank you very much and enjoy today's presentations. Goodbye.